Hello, my name is Donna Thompson. I'm a nurse practitioner that works for the Division of Urogynecology at the University of Pennsylvania Medical Center in Philadelphia, Pennsylvania. I want to thank the International Continence Society for inviting me to talk about SUNA, a SUNA spotlight, to share what SUNA is, who SUNA is, to share what SUNA is doing right now, and some of the things that are going to be happening in the future. So let's talk about SUNA. SUNA, or the Society of Urologic Nurses and Associates, is a professional community of urologic nurses and associates. We are very much committed to improving the professional life of our members and improving the health of our patients and their families through such things as education, research, and evidence-based clinical practice. We're over 2,000 members strong and growing, and we have over 29 local chapters, of which I'm a member of a local chapter, and that's wonderful. I love the networking with the local SUNA members. We have an online community called EuroConnect, which is very active and a great place to ask questions and see what's going on around the country. We publish a peer-reviewed bi-monthly journal called Urologic Nursing, and we publish a newsletter, the Urogram. We also have 2 national conferences, an online library. We offer scholarships, grants, and awards. We support research, and through a sister organization called Sabuna, we offer certification for the associate, the nurse, and the advanced practice clinician. Continence nursing has long been a major subspecialty of SUNA. We, a long time ago, back in 1992, co-sponsored a conference called the Multi-Specialty Conference on Continence. And I remember going to some of those early conferences, and they were wonderful. So I got to network with some of the people that were really on the front line of continence care. That conference then evolved into the 2004 SUNA Symposium, the disorders of the bladder, bowel, and pelvic floor, and I was honored to be the first chairperson of that conference. But it does tell you that SUNA nurses and urology nurses do pay attention to bowel dysfunction as well. We have our urologic conferences that always have a good coverage of urologic topics, and a lot of them on continence. And we've had in the past a series of continence-related special interest groups. We've had a number of special projects, and one of those, which we've just published, is a revision of our scope and standards of practice. We're currently revising the 2009 Advanced Practice Continence Nurse in Long-Term Care. And if you haven't seen it, we have a published core curriculum of urologic nursing. It's on my bookcase, and it's a fabulous resource. We've had the telephone nursing practice in urology, and that came into a lot of demand over the pandemic with COVID-19, just what we're all dealing with right now, when so many of us had to go to a more virtual platform for dealing with our patients. And we're in revision right now for Traces, Making Sense of Urodynamics. This is a series of articles written by Dr. Michael Gray, and he is currently revising them, and the first one I think was just published in Urologic Nursing. They're wonderful and a great resource. Continence nursing has always been a part of a urology nurse's day. Since the beginning, SUNA nurses have been key providers of all aspects of continence management. We currently have another special project to help our members. We're revising clinical practice guidance, and the key author for that revision is Dr. Diane Newman, and that's a stay tuned because they'll be available in early 2021. We have multiple areas of clinical expertise in SUNA, and such as lifestyle modification counseling, behavioral therapy, biofeedback, pelvic organ prolapse management with pessaries, neuromodulation such as sacral nerve stimulation and percutaneous tibial nerve stimulation. Many of our members are urodynamicists, and we're very involved with pre-op and post-op care. Each year, SUNA, in conjunction with the National Association for Continence, recognizes a continence champion. Well, if I'm talking about expert practice, I think it's probably better to hear from the experts. One of those experts is Glenn Sully. He's currently our SUNA Board of Directors Treasurer, and I think he's been in SUNA maybe longer than me. I think he's been in SUNA almost 25 years. So Glenn, we'll let you talk a little bit about neuromodulation. Glenn?
Hi, I'm Glenn Sully. Neuromodulation, or the alteration of nerve activity by delivering electrical stimulation to the sacral nerve, is a favorable treatment option for urology patients experiencing severe symptoms of urinary urgency, frequency, urgent continence, urinary retention, and fecal incontinence. Back in 1998, we tested our first patient here at the University of Oklahoma. And since then, I have seen a countless number of successful results and extremely satisfied patients. It's not guaranteed to work in everybody, but when it does work, it's life-changing. And look at how far we've come in the last 20 years. Implantable devices are smaller, used to look like this, and now look like this in a mini version. They're better, they're faster, and stronger. The new devices can even last up to 15 years battery life, as in the past, they were 3 to 5 years. There's rechargeable batteries now, and these new devices are compatible with MRI. I have worked with several implanters over the years and have been involved in all aspects of this therapy, including pre and post-op teaching, assisting with the lead and implant placement, and performed the majority of neurostimulator programming and troubleshooting for our practice. Throughout the last 20 years, I've been involved with developing and teaching nurse programming courses for industry, nationally and internationally. I've also had the opportunity to present on this topic at several SUNA urologic conferences, which was very exciting. Many of my SUNA colleagues and peers throughout the country have also been closely aligned with managing patients with sacral nerve stimulation. We have many experts among us. SUNA members also are key providers of percutaneous tibial nerve stim, or PTNS, and work with patients to integrate this treatment along with lifestyle modifications and pelvic floor muscle exercises. In addition to education provided by industry, SUNA supports educational needs of our members with offerings at conferences, through continuing education credits via our online library, and of course, networking online with UroConnect. This valuable resource allows us to collaborate, to communicate, and share with other nurses who have similar interests and goals. SUNA is on the leading edge in supporting our members and with new technology. They're always around the corner. SUNA is ready and able. And I am honored and privileged to be an active SABUNA board certified urology nurse. Thank you.
Another clinical expert in SUNA, who is Amy Hull. Amy Hull is a nurse practitioner, and she's our SUNA past president. And she's done a lot of work with pelvic organ prolapse and pessary management. And I think I'll let Glenn talk a little, Amy talk a little bit more about that. Amy?
Hi, my name is Amy Hull, and I'm a nurse practitioner in female pelvic medicine and reconstructive surgery. I'm the immediate past president of SUNA, and I wanted to talk with you a little bit about what we are involved with for women who receive pessary care. Many of our patients with pelvic floor dysfunction do indeed manage their prolapse with pessaries to support the prolapse or pessaries to help with continence. Our patients undergo a fitting process and then enter into a management process if a pessary is indeed an option that works out for them. With SUNA, we're able to provide our members and our attendees at our various workshops and conferences with excellent up-to-date information on pessary care and management of complications, as well as management for patients who do undergo long-term management with this option. So we're very fortunate that we can provide high quality expert information, despite the issues that there's not a lot of information out there regarding pessary care. And so much of our work is also involved with collaboration with other organizations to help us develop some consensus, some better guidance, and hopefully guide the evidence and guide our practices as we develop new evidence-based guidelines for our patients. I hope this is informative for you. I definitely look forward to having opportunities to talk with anybody about pessary management, and hope that we can continue with engagement and collaboration with our colleague organizations to help better provide pessary care for our patients. Thank you so much.
Thank you, Amy. As I mentioned before, many of our SUNA members, many of our urologic nurses are urodynamicists, as is Christy Hagan, a nurse practitioner. She's currently our SUNA director at large. She was newly elected, and she's also the chair of the urodynamic study task force. And I'll let Christy tell you a little bit more about what SUNA's doing and what she's doing in the area of urodynamics. Christy?
Hi, my name is Christy Hagan, and I'm a women's health nurse practitioner from UT Southwestern Medical Center in Dallas, Texas. I currently work in female pelvic medicine and reconstructive surgery. I have been a SUNA member for 5 years now and have previously served as the urodynamic special interest group leader for 2 years. I am also the recipient of a SUNA Young Investigators Grant, in which I am currently using the funds to work on a double-blinded randomized control trial looking at the use of intraurethral lidocaine versus placebo effect on patient comfort and systometric parameters during urodynamics, utilizing the patient as their own control. I am currently the director at large for SUNA, and I will be acting as the new board liaison and chairperson for our upcoming urodynamics task force. As we all know, SUNA has long been an ICS approved provider of urodynamics education, and urodynamics is a major component of many SUNA members' daily lives. This new task force is going to review and revise our offerings and also contribute to defining the role of the continence nurse related to urodynamics. Overall, our goal is always to improve patient care through education and evidence-based practice.
SUNA is very collaborative. We know that we work together with many clinicians in the healthcare arena. And we have been in collaborative practice with many of our fellow professional organizations, such as the National Association for Continence, the American Urologic Association, the American Urogynecology Society, multiple nursing organizations, and of course, like today, the International Continence Society. SUNA is very involved with supporting research. And no one knows this better than Dr. Gwen Hooper. She is our SUNA Research Committee Chair, and she is also a SUNA past president. She can tell you better about the 3 ongoing research studies supported by a grant from the SUNA Foundation. Dr. Hooper?
Hello, my name is Dr. Gwendolyn Hooper. I'm an associate professor at the University of Alabama, Capstone College of Nursing, a urology nurse practitioner, a researcher, and the research chair for the Society of Urologic Nurses and Associates, also known as SUNA. SUNA recognizes the importance of scientific inquiry for the practice of urologic nursing. Presently, we have 3 ongoing research studies supported by funding from the SUNA Foundation. These studies will examine evidence in the use of lidocaine for reducing discomfort during urodynamic studies. One will look at practice patterns and roles of pelvic floor specialists in urinary incontinence, and one will look at nursing care practices for patients with long-term catheter use. In addition, each year we seek out and promote research abstracts for our urologic conferences. As research chair, my goals are to create an environment within our organization that will encourage our members to seek out opportunities to either conduct, participate in, or contribute to urologic nursing research. A secondary goal will be to empower and educate our members in the fundamentals of research to prepare them to practice in interdisciplinary research within their institutions in large urology group practices. Nursing research is the scientific basis for the practice of urologic nursing. It is part of our mission statement as an organization, part of our professional community, and part of our commitment to improving patient care.
Education is very, very much a part of SUNA. And if you would go onto our website, you'd see some newly revised patient fact sheets. These are to help clinicians in patient education. It is an ongoing project of SUNA to add new patient fact sheets as needed, and it's been a big project. We also have our 2 conferences, a general conference, and we also have a focused conference for the advanced practice clinician. And this is a 2-day conference which focuses primarily on the needs of the advanced practice provider. We're also looking forward to a new education issue in Urologic Nursing Journal. I'm looking forward to that one. It's a special issue on pre and post-operative care of patients. And if you need CE, SUNA's got them. We offer CEs through our journal, Urologic Nursing Journal, and also an extensive supply of CEs and wonderful educational offerings on our own online library. Another aspect of professional nursing and urology nursing, continence nursing, is advocacy. And I'd like to ask Gina Pally, who is the current SUNA Board of Directors President, to talk about some of the things that SUNA has been doing in terms of advocacy. Gina?
Thank you, Donna, for all your work with incontinence nursing and SUNA. Hi, my name is Gina Pally, and I am the current SUNA President. But most importantly, I'm an incontinence nurse practitioner too. SUNA plays an important role in regards to political advocacy. SUNA is a member of the Nursing Community Coalition. We have had our organization included on numerous letters in support of legislation to help further nursing, including the Future Advancement of Academic Nursing Act, the U.S. Cadet Nurse Corps Service Recognition Act, COVID-19, Title VIII Nursing Workforce Development Programs, just to name a few. SUNA support APNs independent practice. APNs are the key providers of non-surgical approaches to treat incontinence. Incontinence nurses educate patients with behavior therapy. We perform urodynamics and biofeedback, as well as neuromodulation, pelvic floor physical therapy, pessaries, pre and post-op patient care. But most importantly, we help reinforce the patient's goals every time we see them in clinic. SUNA supported the white paper drafted by the American Association for Home Care in conjunction with WOCN and NAVSE, keeping patients at home with improved outcomes through use of quality incontinence products and HME providers. SUNA established a task force to determine ways to improve bladder health awareness in the community. This task force, along with the National Association for Incontinence and the Simon Foundation for Continence, developed a bladder health community awareness presentation that any urology healthcare professional can utilize for bladder health presentation in his or her community. Bladder health promotion is an important concern for everyone. SUNA collaborates with many organizations, as you've already heard. We also have a relationship with the AUA as a part of the Bladder Health Alliance with their Urology Care Foundation. In 2016, the Alliance was successful in proclaiming November as National Bladder Health Month in the United States. Thank you for allowing me to be a part of this timely and important presentation.
Thank you so much, Gina. SUNA has a couple new projects, other new projects that are happening right now. And one special project is looking at redefining the role of the urologic continence nurse specialist. We're looking to define the scope of formal and informal education needed by nurses related to continence across the full spectrum of continence nursing. So that's another stay tuned. It's a big project and we're really looking forward to working with nurses and to see how we can further expand our offerings in SUNA. We have another special project that has just recently launched. It's a national survey of continence and pelvic floor specialists. Dr. Jean Weinman is the primary investigator, with other investigators as Dr. Amanda Berry, Dr. Diane Newman, and Dr. Christine Talley. This study, which is sponsored in part by SUNA, is a cross-sectional research design involving an anonymous online survey, and you may have received that survey, so please help us out. We're going to collect the researchers are going to be collecting data on demographic characteristics, practice characteristics, professional role, economic factors, practice barriers, for both nurses and non-physician specialists who provide continence and pelvic floor care to both children and adults here in the United States. They're going to examine differences in role activities based on demographic characteristics. We're really looking forward to the results of this study. And like I said, this study is ongoing right now. SUNA has a lot going on. We're doing a lot. We're planning a lot. And if you want to know a little more about us, you want to interact with us, please visit the SUNA website at www.suna.org. And again, I wanted to thank the International Continence Society for inviting us here to share some of the things that we're doing and some of the directions we're heading in. Thank you and have a good day.